Welcome back and thanks for staying with us. Let's bring you this discussion now. The Gauteng Health Department is worried about an increase in the number of sexually transmitted infections in parts of the province. The department says the STI incident has gone up from around 12% in 2020 to about 15% last year. Now, there are a number of factors that are driving this trend, including an apparent lack of caution by those who are sexually active. Let's get you a better understanding of this problem. Bring in Dr Nombuso Madonsela, who's a medical advisor for HAST. That's a division of the department that deals with HIV, TB, and STIs. Dr. Madonsela joins us now via our video link, and it's lovely to have you on the program, Doc. Thanks very much indeed for making time. It might feel a bit counterintuitive that in 2024, we're still talking about people potentially not having essentially safe sex and that driving STIs in the province, but it appears that's what you're seeing.
Yes, we are seeing an increase of our sexually transmitted infections, and as a department, we are worried about this trend that we are seeing. As we are looking at the issues of behavioral change as drivers for us to improve our STI infections that have increased in various parts of the Gauteng Department of Health. We have lately introduced our township informal sector and hostel outreach programs where we are screening for STI, and we are picking up a lot of STI infections, especially in our younger, which is our youth age group.
Yeah.
And it is very worrying because it means that there is a challenge with behavioral and unprotected sexual activities happening in our communities.
Right. And let's speak a bit more about that, Doc. I mean, in a statement released from the department last month, you speak about a number of infections. Gonorrhea is one of them, syphilis, and what's called male uretitis syndrome. Can you speak to us a bit more about the last one I just mentioned there? How does this manifest?
So with male urethritis syndrome, we normally are measuring that from our male population. They normally present with, it is a mixture of gonorrhea, mainly gonorrhea and other sexually transmitted infections. And the main presentation is that they normally have burning of maturation. They will have a discharge. Sometimes it's white, sometimes it's yellowish. Others will have swellings. And they present to the facilities with those particular symptoms.
Yeah. What does this say to the department about the interventions that we've spoken about for years now and the extent to which perhaps they're not working? I mean, there were all kinds of campaigns, for example, about having safe sex by condomizing. PrEP is available in many instances, especially for certain populations or certain groups of people. Is the department considering other interventions, or is it just about doubling down on these and making sure that they're as accessible as possible?
So as a department, we have looked at the areas that are mainly affected, which is our inner city in Johannesburg and Hillbrow, the mining area in Carltonville. We also have the farm areas. And in the inner city, we are looking at our, we've got many factors that are driving this from our population. We know that we have a high number of people who are having unprotected sex. We also have the community having multiple partners. And what we're also seeing is that when they have indulged in substance, either it's alcohol or drugs, then all precautions are let go. And we also have seen that we have a lot of cultural norms and stigma where we find that the utilization of condoms is not consistent, and sometimes it is frowned upon, especially if a female will be bringing a condom to their male partner. We have situations of gender-based violence, unable to actually negotiate safer sex. So we are working with the different age groups and communities where we are finding the high transmission of infections to really have honest discussions and to ensure that we also promote the consistent condom use, because we are seeing that they are also using condoms inconsistently. The department has launched years ago the colored condoms, which are freely available in all facilities. We also distribute them to our taverns, all our high transmission areas where we think our communities can have easier access of condoms. But it all boils down to ensuring that you as an individual take accountability of your sexual reproductive health and reduce the number of multiple partners, use condoms, and we have now also introduced PrEP, which is available also in our facilities. And PrEP, I must add, is just to prevent HIV, but we use it as a dual protection, as a better method, because we use both condoms and the PrEP in order for our community to be protected.
Yeah, you know, some doctors in health have spoken to us about sometimes how layered all of this can be, you know. In fact, there's a perception out there that you can't address issues like prevalence in STIs and HIV without speaking to the socio-economic conditions that underpin risk groups. You know, in our discussion, you spoke about, for example, younger people being susceptible to infection. And in many instances, some of the sexual interaction is transactional. In other words, it's for upward economic mobility. To what extent does the health department reckon that complicates the issue, the fact that there are socio-economic factors here at play?
So as a department, we understand that there are social issues, and we've seen intergenerational sex being part of what is driving the high number of STIs and also the HIV epidemic. And we have got programs which are like She Conquers and Dreams, where we try to empower. We work on empowering our young women to be able to negotiate safer sex and to empower them as well to ensure that they are economically empowered through the social development and other. But our main home message to the community is that as people who are sexually active out there, there are condoms, there are better methods for us to be able to negotiate a safer sex, and we request that they should be accessing those services. And if they have any sexually transmitted infection symptoms, they should avail themselves to our nearest facility because they are available. The department has also launched the Serve with a Smile, and we know that for our men, it becomes difficult for them to go to our facilities, but they can access our services. We've got male health clinics that are there to service men so that they can have a fast queue when they get to the facilities. I think it is a combination of a lot of issues, social, cultural, and also ensuring that whenever they are engaging in sexual activity, they have the knowledge of what they can utilize to prevent sexual transmitted infections.
All right, Dr. Nombuso Madonsela, thanks for your time. Appreciate your insights on the agenda this morning. Dr. Madonsela is a medical advisor with the Gauteng Health Department.